All right, today we're going to be talking about the skeletal system. So there are a few different functions of the skeletal system. The one that we usually think of is support and protection and also movement. But our skeletal system is also really important in storing minerals and lipids. This is going to be things like calcium, phosphates, salts, yellow bone marrow, things like that. It also helps to regulate our blood calcium levels, and it is responsible for hematopoiesis. What hematopoiesis is production of red blood cells. So we're going to talk a little bit more about all of those functions as we go through. So in general, there are 206 bones in an adult human. Most of them are going to be located in the hands and feet. There's going to be about 27 in the hand and 26 in the foot. There are 300 bones in an infant. And the reason why there is such a difference in the number of bones in an infant is because a lot of their bones are not yet ossified. So they have a whole lot of cartilage connecting much smaller bones. So until that cartilage ossifies into bone, then there's just a whole lot more bones to them. Our largest bone is going to be the femur. That is going to be our thigh bone. And our smallest bone in the human body is going to be the stapes. We find that inside the middle ear. So the main tissue types of the skeleton are going to be bone and other connective tissues. So when we're talking about bone, we're going to have two primary types. We're going to have compact bone. This is going to make up our dense outer layer of bone. This is what you often think of as being bone and the bone that we typically see. We also have spongy bone. Spongy bone is going to be the porous inner layer that is inside of bone, and it's very important, and we'll talk about all the reasons why in a few slides. As far as other connective tissues, we have bone marrow. We have two different kinds of bone marrow. We have yellow and red bone marrow. We have ligaments. Ligaments are going to connect bone to bone. We have tendons, which are going to connect muscle to bone, and we have cartilage. Cartilage provides protection at our joints. So bones are primarily classified by their shape. So if you look at these bones pulled out here, you can see the naming of them is very characteristic to how they are shaped. So the first we're going to talk about are long bones. Long bones are going to be longer than they are wide. They're going to have a shaft in the middle with this like out bowing of what we call heads at both ends. These are going to be mostly made of compact bone tissue, and they're going to have a little cavity that runs through the middle. An example of long bones would be things like our femur and like our humerus, so arm bones, leg bones, things like that. All right, here's a diagram of a long bone. Definitely know all of the labels of the long bone and why all of these regions are important. So the first section we're going to talk about is right here. This is going to be the diaphysis. This is going to be the shaft of the long bone. It is going to consist of primarily compact bone and a medullary cavity. That medullary cavity is going to be this hollow section on the inside. It is going to contain yellow bone marrow and also the blood vessels that run through it that you can see here. The diaphysis is also going to have periosteum. That's going to be the outer covering on the bone. So if you've ever had like a chicken bone and you've kind of scratched at it and seen that it almost has like a little like skin layer on top, that's what we're talking about when we're talking about a periosteum. We also have the epiphysis, and the epiphysis is the head of the long bone. You're going to have a proximal and a distal epiphysis. These are going to be made primarily of spongy bone. They're going to contain red bone marrow, and why red bone marrow is so important is because that is where that hematopoiesis or blood cell production is taking place. Within this area, we also have an epiphyseal plate. This is the growth plate. So this is where we have hyaline cartilage. And you can see this little line here of hyaline cartilage. This we see in growing bones. So when your bone is growing, it is growing out from this area right here. When the bone is done growing, we see an epiphyseal line. An epiphyseal line is essentially like the scar tissue of where that cartilage used to be. And then we will also see articular cartilage. So articular cartilage is going to be hyaline cartilage, which is going to decrease friction at the joints. So our next classification of bones is going to be our short bones. Our short bones are going to be cube shaped. They're going to be mostly spongy bone. And these are going to be things like our carpals and our tarsals. So like our wrist is a really, really good example of this. We also have flat bones. These are going to be thin, flattened. They're usually going to be a little bit curved. They're going to have two thin layers of compact bone surrounding a thin layer of spongy bone. Examples of this are going to be like our skull, our ribs, our sternum, bones like that. We're also going to have irregular bones. Irregular bones are bones that just, their shape doesn't really fit nicely into any of those categories or boxes we just talked about. These are going to be things like vertebrae and our pelvis that are just very, very strangely shaped. I put a little table in here for you all so that you can look at some of the different bones that we have and see where they would be classified. And then also there is going to be a list here of bone markings. So we have a few different ones we talk about. Like if we talk about a tuberosity, that is going to be a large rounded projection. So we talk about tuberosities a lot when we are talking about how the femur locks in with the hip. We will talk about crest, which is going to be a narrow ridge of bone. We see that on the pelvis. I really want you all to go through this whole list and kind of know what each of these are, because as we are trying to identify bones, knowing this verbiage is important and helpful for you to be able to identify which bones you're looking at. So let's talk a little bit about the microanatomy of bones. So remember that there are two types of bones, right? We have compact and spongy. Bone tissue is going to be made primarily of extracellular matrix, with bone cells spread all throughout that extracellular matrix. The extracellular matrix of bone is going to be made of proteins like collagen. Collagen is really, really, really important in this process because this is what provides the little bit of flexibility that our bones have. And also we are going to have minerals like calcium and phosphorus, and this is what makes our bones really, really strong. In the compact bone, this bone is going to be a lot denser. This is going to be the bone tissue used to create the hard outer shell of bones. And an important thing that you absolutely definitely need to know is that osteons are going to be the basic structural unit of compact bone. Osteons are going to be circular calcified columns of that extracellular matrix. The purpose of these columns is to provide strength. So let's zoom in a little bit on the osteon and talk about what is contained within it. So within the osteon, we will see lamellae. Lamellae are going to be thin, like little ring-like calcified sheets of the osteon that almost look like tree rings. So each layer of the lamellae is going to have lots and lots of little tiny pits. And we call these pits lacunae. So lacunae, that is actually Latin for little cave. And inside those little caves is where our osteocytes are going to live. So our osteocytes are going to be the bone cells found inside of each lacunae, and they're so very important, and we will talk about why they're important in just a moment. So we are also going to have central canals. You will also see this written as Haversian canals. Haversian is the old name that they used to call it, whereas now they refer to it as a central canal. Our central canals are going to contain the blood vessels and nerves that are going to run through this bony tissue. And each lacunae is going to be connected to each other and to the central canal through tiny hollow channels called caniculi. So you're going to have your Haversian canals going in one direction and your caniculi going in the other direction, almost to make this grid system so that everything interconnects. So what is an osteocyte anyway? An osteocyte is going to be a mature bone cell. It's going to be found inside the lacunae of those osteons. It is going to control other types of bone cells. So this is going to help regulate the homeostasis of the bone, and it is going to kind of control what is happening in that extracellular matrix that is making up bone. So why would we make osteons shaped like this? I gave you all an example here. These are the cables that they use to make like bridges. This structure of like circular layers or really like hexagonal layers layered upon each other and then layered upon each other again provides a really, really strong structure that is also flexible. So this is why this structure is so important, and this is why osteons are set up this way. So let's talk a little bit about spongy bone. Spongy bone is going to be porous bone tissue, which contains the red bone marrow. Like if you look at that, it is absolutely, you can see why it's called spongy bone. It has all these little holes in it. It is going to have trabeculae. These are these tiny little honeycomb-like support structures. This helps bone resist compression and stress, and is going to contain the red bone marrow. So this red bone marrow that's contained in these trabeculae produce the red blood cells that we use all throughout our body through this process of hematopoiesis. So the way that this happens is the spongy bone is going to contain that red bone marrow, which is then going to house stem cells. So those stem cells will wait until they're needed, and then whenever they are needed, they're going to differentiate into red blood cells, white blood cells, and platelets, depending on what is needed at that time. Here are some other really important cells. We already talked a little bit about osteocytes. These are mature cells which are going to monitor and maintain the bone matrix. We also have osteoblasts. Osteoblasts are our bone builders. So whenever we need to build new tissue, either initially or when something goes wrong, we do this through ossification, which means that they are creating new extracellular matrix. So they're just building up and up and up on top of this extracellular matrix to make layers and layers and layers of bone, just like the rings of a tree. We also have osteoclasts, and osteoclasts are going to be our bone breakers. So they break down old bone through the process of reabsorption. The reason why this is important is because sometimes bone just wears out and needs to be replaced, but also we might have a bone that breaks and heals incorrectly or something like that, and these can help in that process of kind of remodeling that bone when it needs remodeling. I definitely want you to know all three of these types of bone cells. So let's talk a little bit about bone remodeling. This is going to be the reshaping and replacement of bone tissue. About 10% of our bone tissue is going to be replaced yearly. It occurs just normally as a regular process, but it's also going to occur in response to injury. So our bones are going to grow or remodel in response to the demands placed on them. We call this Wolff's Law. So exercise can stimulate remodeling and strengthen bones. Bones may be slightly different sizes depending on use and injuries. Inactivity or a sedentary lifestyle can lead to a little bit weaker bones. And poor posture can sometimes lead to pain in the shoulders and neck and tension headaches and stuff like that, because eventually if you keep a bone in a position long enough, the bone will kind of remodel in that direction. So here is the process of bone remodeling after a fracture. So the very first step that is going to happen is we're going to get a hematoma formation, right? So that's like a big blood clot. After that, we are going to have a fibrocartilage callus formation. And this is also when we are going to start to grow our new blood vessels through that area. And then the third step, we're going to get a bony callus formation. So that is going to be like a slightly stronger formation. And then after that, those blood vessels will go ahead and come all the way through, and that blood will be healed. I mean, that bone will be healed. Sorry about that. So we've talked about all of this before in the slides leading up to this, but just to kind of put it all together, this process of ossification is going to occur over our lifetime. So ossification is going to be the process of cartilage becoming bone. This is going to be done by those osteoblasts that we talked about. So before birth, fetal bones are going to be mostly cartilage. Over time, those bones are going to ossify, And then as a child grows, they're going to have those growth plates or those epiphyseal plates that we talked about earlier. So those are going to increase bone length as the children grow. And then eventually those growth plates will ossify in young adulthood. And I put this diagram in here just to help with your studying. So that is that whole process of ossification that we just talked through, just in diagram form so that you can actually see it in a tangible way. So this epiphyseal line that we talked about becomes really important because when little kids like break a bone, we can look at that epiphyseal line on the x-ray. We saw a few of these in lab where we saw the difference between that epiphyseal line and that epiphyseal plate. And so we can look at that and we can see if that bone is still growing. This is really, really important because whenever we have bone fractures, if that happens across one of those growth plates, it can interfere with regular bone growth. So that is a very big deal. So let's talk a little bit about specific bones of the skeleton that I'm going to want you to know. So we're going to classify our skeleton in two different ways. We are going to have the axial skeleton, which is going to be the skull, the vertebrae, and the ribs. And it's going to consist of 80 bones. These are going to be the bones along the central axis. This is, again, going to be the skull, the vertebral column, and the thoracic cage. We're also going to have an appendicular skeleton. This is going to be 126 bones. This is going to be made up of the appendages, the pectoral girdle, the pelvic girdle, and like upper limbs and lower limbs. So let's talk a little bit about our axial skull. So we're going to have 8 cranial bones. We are going to have a frontal bone. We are going to have an occipital bone, and you can see these over here. We are going to have 2 parietal bones, and they're going to be right here on the side, these little green portions. We're going to have 2 temporal bones. Those are going to fall right around your temples. We're going to have a sphenoid, and we are going to have an ethmoid. So the ethmoid is going to be this little bitty guy that goes right here. And then we will also have our sphenoid way back here, and you can see kind of on the side where it comes in. I will have a few different views of these skulls for you guys to be able to look at as you're studying. We will also have a mastoid process. So that is going to be very, very, very important with all of like the jaw connection. We will also have the styloid process, and then we will have 14 facial bones. So we will have 2 maxilla. These are going to be our maxilla right here that are going to make up the upper portion of our jaw. We will have a mandible, which is going to make up the lower portion of the jaw. And we're going to have 2 zygomatic bones. These are our cheekbones, our zygomatic bones right here. We will also have 2 nasal bones right here. And our lacrimal bones. So these are going to be itty bitty, and these are going to fall right here, like where our lacrimal glands are going to be. Those are going to be the glands that make tears for us. And then we will have 1 vomer also. And some of these are really, really, really hard to see. So I'm going to show you a different view here where things are kind of flipped to the side. And these are a little bit easier to see. So you can definitely see the lacrimal bone way easier from this angle. You can also see the ethmoid bone a lot easier. We can see our occipital bone, which was hidden before behind the skull. And then our temporal bone, we were able to see on the other one, our parietal and our frontal, we were pretty able to see those as well. You can see the zygomatic bone really well here. You can see your mastoid process, which is going to interact with your jaw right here, and then your styloid process. Let's see if there's anything else that I want to point out to you here. I think pretty much everything else we were able to see on the other view, but that's why I put these different views in here for you, because you should be studying this a whole lot of different ways. Here's a picture of an actual skull as opposed to an illustration skull, in case that helps with your viewing. And here is an inferior view of the skull. So we're looking at all of these bones, but we're looking at it from the bottom. So you can definitely see the mandibular fossa a lot better. You can see the foramen magnum. This is incredibly important. Definitely know this one. This is where the spine is going to attach to the skull. So it is incredibly, incredibly important. And you're finally able to see that vomer that we haven't been able to see on any of the other slides. The vomer is going to be right here. So it is going to be almost not really at the roof of the mouth, kind of, but a little bit back from that as well. So very deeply into the roof of the mouth. Here is a diagram on an actual skull to help with your studying. And then here is another view of this with the top of the skull removed. So before you were looking from the bottom up, now you're looking from the top down. So just lots and lots of different angles for you all so that you are able to see this a different way. Here's your very, very difficult to see bones. So the sphenoid is going to form the base of the cranium behind the eyes. It's really hard to see on our models, but on this one, this little 3D cutout right here, it is way easier to see. And your ethmoid is going to kind of form the back area of those nasal passages. So let's talk a little bit about those paranasal sinuses and sinuses in general. So these are going to be our hollow mucosa-lined air cavities. Their functions are going to be to lighten the skull, to give resonance and amplification to the voice, and to produce mucus to moisturize the inside of the nose. You can see them right here. They've taken a skull and they've kind of like shaved off the top half. So you can see we have a maxillary sinus right here, an ethmoid sinus here, a frontal sinus up here on top of the skull. So definitely know all of those. The fetal skull is going to be super large compared to the infant's total body length. And remember, because those bones are not fused, because we need it to be a little flexible for the process of birth, we will have what we call fontanelles. Fontanelles is just a very fancy science word for soft spots. So these are going to be the fibrous membranes that connect the cranial bones. They're going to allow the brain to grow really, really quickly. And they usually convert to regular bone within about 2 years after birth. Here's another look at the fetal skull side by side with the pelvis. The reason that the fetal skull has to be shaped the way that it is because it has to make its way through that pelvis. Let's talk about the hyoid bone. I was so proud of you all in lab because everybody put the hyoid bone exactly where it goes, and that's usually one that messes people up. The hyoid bone is the only bone that does not attach to another bone. It serves as a movable base for the tongue, and it is going to aid in swallowing and speech. Let's talk a little bit about our vertebral column. So we're going to have individual vertebrae. These are going to be separated by intervertebral disc. These are going to be little pads of fiber cartilage that just provide a little bit of cushion. We're going to have 7 cervical vertebrae. These are going to be the ones in red right here. We're going to have 12 thoracic vertebrae. These are going to be the ones in blue. We're going to have 5 lumbar vertebrae. Frequently when people have back surgeries, it is very, very frequently on the L4 and L5 of these lumbar vertebrae, so these way down here at the bottom. We're also going to have a sacrum, and we're going to have our coccyx. Our coccyx is like our tailbone. So let's talk about the atlas and the axis. These are going to be the 2 most superior vertebrae. They're going to allow the head to pivot and to nod. So we have our atlas and then we have our axis, and they really just set right down into each other just like that right there. I gave you a few different views of these because they are so important, so that you can see them from different angles, because this dens is a very important little process on this bone, so I wanted you all to be able to see these different structures. So let's talk a little bit about our cervical vertebrae. We already said that we have 7 of them. This is going to include the atlas and the axis. These are going to be our smallest vertebrae. They are easy to distinguish because of the 2 extra foramen. Foramen is just a very fancy science word for holes. You can see these extra foramen on either side of them. So that is how we are able to distinguish those cervical vertebrae. We're going to have our 12 thoracic vertebrae. These are easy to distinguish because they have the facets that articulate with the ribs. So that's going to be these little flat sections right here. We are going to have 5 lumbar vertebrae. These are going to be in our lower back. These are going to be the largest, and they also support the upper body weight. So they're very, 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 very strong. We're going to have the sacrum. This is actually 5 vertebrae that have fused together. This is very important in helping to form the pelvis. And then we're going to have our coccyx, which again is that tailbone. And this is the fusion of about 3 to 5 vertebrae. Sometimes it varies person to person. So let's talk a little bit about our thorax. A very important part of our thorax is our breastbone. We refer to this as the sternum. So the sternum is the medical name for the breastbone. It has the xiphoid process. The xiphoid process is going to be right here. It is very, very important because it is the attachment site for the diaphragm. So we need this attachment site to be able to breathe. We're going to have a whole lot of different ribs. We're going to have 7 pairs of true ribs. In a true rib, the cartilage is going to attach directly to the sternum. We're going to have 3 pairs of false ribs in which the cartilage is going to attach to the other cartilage of the true ribs. And then we are going to have 2 pairs of floating ribs. So the floating ribs are literally just floating right here. They do not attach to the sternum in any way. So let's talk a little bit about that pectoral girdle. The pectoral girdle is going to be composed of our clavicles and our scapula. So our clavicles are going to stabilize the shoulder. They are structurally a little bit weak because of the shape, so they can break really pretty easily. And our scapula are going to provide attachments for our shoulder muscles. So this is going to be this big triangular one right here. When we're talking about our upper limbs of our appendicular skeleton, we have a humerus, which is going to be our top arm bone right here. We're going to have a radius, and we're going to have an ulna. We will have carpals in our wrist. We'll have metacarpals. Metacarpals are going to make up our palm area. And then we will have phalanges, which are going to be our fingers and our thumb. So an interesting thing about the radius and ulna is those bones actually cross over each other depending on how you are moving your hand. So your radius is always going to be on the thumb side, and your ulna is always going to be on the pinky side. And even if you turn your wrist, those bones are actually going to turn and cross over each other to where that radius is still on the thumb side and the ulna is still on the pinky side. So when we are looking at our hands, we have carpals. So again, these are our wrist bones. We're going to have metacarpals, which are going to make up our palms, and then we're going to have our phalanges, which are going to make up our fingers. When we have carpal tunnel syndrome, that is going to be due to this median nerve that runs through the passage between those carpal bones and ligaments. It can become compressed because of all of those carpal bones, and then it can get a little bit inflamed. So that is what is happening whenever we have carpal tunnel syndrome. Let's talk a little bit about our pelvis. So the pelvic girdle is going to consist of the hips. For the pelvis, we're going to have 2 coaxial bones. These are going to be held together by the pubic symphysis anteriorly and the sacrum posteriorly. We're going to have the sacrum, and we're also going to have the coccyx. This is going to support the total weight of our upper body. So these bones are all incredibly strong, and the way that they are shaped helps with this strength. When we are looking at our lower limbs, we're going to have the femur. That's going to be our thigh bone here. Our patella, which is the kneecap. We're going to have a tibia and a fibula, which are going to be these bones down here on the lower leg. We'll have our tarsals, our metatarsals, and our phalanges. So again, our phalanges are going to make up our toes. Our metatarsals are going to be right above that, and then our tarsals are going to be right here in this ankle region. The femur is going to be the strongest bone in the whole body. It is the thigh bone. It is going to form the hip joint with the pelvis and the knee joint with the tibia and the fibula. So the tibia is going to be our shin bone. It is going to be the bigger bone when we're looking at just these lower leg bones. And the fibula is going to be lateral to the tibia. It is going to stabilize the ankle, and it is going to be the smaller bone when we're looking at these. When we are looking at our foot, we have our tarsal bones, which are making up our ankle. We are going to have our metatarsals, which are going to make up the arch and the ball of our foot. And then we will have our phalanges, which are our toes. So let's talk a little bit about joints. We're going to have a few different types of skeletal joints. You'll also hear these referred to as articulations. So these are going to be regions where bones attach to one another. They're going to be classified by their movement and their structure. So we will have fibrous joints. These are going to be mostly immovable. We were going to have cartilaginous joints. These are going to be slightly movable. And we will have synovial joints. These are going to be freely movable. Sorry about that, if everything just froze up and looked crazy for a second. My recording kind of freaked out for a minute. I think we have it fixed now. So let's do a little vocab review from the beginning of this lecture. So we have ligaments, right? These are connective tissue that are going to connect bone to bone. And we also have tendons. And these are going to be connective tissue that are going to connect muscle to bone. Right, so the first type of joints we're going to talk about are going to be fibrous joints. These are going to be bones joined by fibrous connective tissue. These are generally completely immovable. So examples of this are going to be like cranial sutures, teeth, and then we're going to have a few different classifications of this. So our suture joints are going to be held together with very short interconnecting fibers, and this is going to be like our skull. We can also have syndesmosis. Syndesmosis joints are going to be held together by a ligament. The fibrous tissue can vary in length, but is going to be a little bit longer than the sutures. We see this between the tibia and the fibula. And then we can also have gomphosis. These are going to be like a peg and socket type joint. So this is going to be like how our teeth are held in. We can also have cartilaginous joints. So these are going to be bones that are connected by cartilage. These are going to be slightly movable. So examples of this is going to be like the pubic symphysis, the intervertebral joints, the ribs, and the epiphyseal plates, or those growth plates that we talked about. So we're going to have two different kinds here. So we're going to have synchondroses. These are going to be bones that are going to be united by hyaline cartilage. So it depends on the type of cartilage that they are made of which of these groups that they go into. These are going to be the ones that we see at the epiphyseal plate. And this is also the kind of joint that we see to connect the sternum and the ribs. So that cartilage that runs between the sternum and the ribs is going to be this type of cartilage. We also see symphysis. So what a symphysis is it's going to be bones that are united by fibrocartilage. You can see this fibrocartilage right here. So this is going to be like connected vertebrae and also our pelvis. We also have synovial joints. In synovial joints, the bones are going to be separated by a joint cavity. These are going to be freely movable. This is the most common joint type in the body and probably what you think of when someone says the word joint. So these are going to be complex structures, and there's going to be a few different components that make up these structures. So first, we're going to have articular cartilage. This is going to cover the ends of the bones and protect them. We're also going to have a fibrous joint capsule. This is going to unite the bones and enclose this space to create a joint cavity. And then that joint cavity is then going to be filled with synovial fluid. This synovial fluid is going to be for the purpose of reducing friction between the bones. We demonstrated this in lab when we made our fist and we put the balloon between them. We were mimicking a synovial joint. We're also going to have ligaments that are going to help to reinforce the joint to keep it strong and to protect the synovial joint from injury. So many synovial joints are also going to contain bursa and meniscus to add extra padding and friction reduction. So bursa are going to be like fluid-filled sacs that are going to cushion the various joints. And meniscus are going to be like extra cartilaginous pads of tissues between bones. So you have meniscus in your knee. If you've ever like torn a knee meniscus, you're very familiar with like just how different your knee can feel when these little pads are a little bit damaged. We're going to have 6 different types of synovial joints, and we're going to talk about all of them. We're going to have a plane joint, which is going to have a gliding motion. A hinge joint, which is going to have like a flexing or extending motion. A pivot joint, which is going to do rotation. A condylar joint, which is almost a ball and socket, but not quite. A saddle joint, which is going to be saddle shaped. And a ball and socket joint, which is going to give us the most movement, but is also going to be the most fragile. And we see that like in the hip. So I gave you this animation that shows how these work to hopefully just help with your understanding and your studying. Let's talk about each of these different joint types. So the plane or gliding joint is going to allow movement, but only on a single plane. We see this like between carpals or between tarsals. A hinge joint is going to be one you're very familiar with. So this is going to allow like flexion and extension along a single plane. This is going to be things like our elbow, our knee, our ankle, between our phalanges, things like this. A pivot joint is going to allow for rotation on a single plane. We see this between the axis and atlas, or between our ulna and our radius. Our condylar joints are going to allow angular movements, but it's going to allow it in 2 different planes. So we see this between like our metacarpals or metatarsals and our phalanges. We also have saddle joints. This is going to allow like a circular and angular movement in 2 planes. So we see this between carpals and metacarpals of the thumb. If you can spin your thumb around, that is what allows that type of movement. We also have ball and socket joints. So this is going to allow 360 movement, like in your hip bone. You also have this in your shoulder. So this is going to be where the head of one bone is going to rest into the depression of another. These are really cool joints. Again, it's giving you the most movement, but they are also the most fragile and the most prone to coming out of socket because they are so exposed. So let's talk just a little bit about skeletal injuries, fractures, and other skeletal disorders that you might see. We're probably all familiar with sprains and torn ligaments. This can be caused by stretching or tearing of the fibrous tissue, which connects the bones. Also torn meniscus, we just talked about this a little bit earlier. This is going to be the most common twisting knee injury. That meniscus, the purpose of it is for shock absorption of that cartilage in the knee. So when it is torn, you do not get that shock absorption and it is really painful. You can also have bursitis. This is going to be inflammation of the fluid-filled bursa around the joints. Or we can have arthritis. So this is going to be inflammation of the joints themselves. There are over 100 different types of arthritis. The most common ones are going to be like osteoarthritis, rheumatoid arthritis, and gout. But arthritis is actually a way more extensive disorder than a lot of people realize. You can have hypermobility. So hypermobility is going to be a condition where there is a greater range of motion in joints. This can be due to faulty or weak collagen proteins caused by genetic connective tissue disorders. It can lead to weakened cartilage, ligaments, or tendons to where you are very, very, very flexible. So let's talk a little bit about osteoarthritis. This is where the protective articular cartilage at the ends of bones wears down. It's going to cause pain and tenderness, joint stiffness, bone spurs, and a loss of flexibility. Some risk factors for this are going to be primarily older age, a lot of old like joint issues or overuse of joint issues, and this is going to be way more common in women. You can also have bone dislocations or fractures. Dislocations are going to occur when bones are displaced from the normal position at the joint. It can be very, very painful and potentially damage the tissue surrounding the joint. Fractures are going to occur when a physical force on a bone is going to cause it to break. In a simple fracture, the bone does not break through the skin. In a compound fracture, the bone actually breaks and then the bone comes through the skin. This is the more complex fracture because you have an increased risk of bleeding and infection anytime you're breaking the skin. So let's talk about a few different types of fractures. So we have transverse fractures, which is going to be where the fracture is perpendicular to the bone. So it is at exactly a 90-degree angle. We can also have oblique fractures, which is like a diagonal fracture to the bone. We have spiral fractures, which is where the fracture spirals around a bone. This often happens to like long bones. This happens when the bone is broken by a rotational or a twisting type force. We can also have fractures that involve a bone just shattering into multiple pieces or fragments. We call these comminuted fractures because they're really, really, really hard to fix. You can have an avulsion, and what an avulsion is where a ligament or tendon like tears off a little piece of bone. We can also have impacted fractures. So impacted fractures are fractures where the broken ends of the bone end up kind of like jammed together. This happens a lot in hips. We can also have compression fractures, which is going to be a fracture which causes crumbling of the vertebrae. This is most common in people with osteoporosis because they already have that weakness in the bone. We can have hairline fractures or stress fractures. These are going to be small, common cracks in the bone. They're often really difficult to see on an x-ray. And we can also see green stick fractures. These are going to be way, way, way more likely in children due to them having way more cartilage in the bone, which makes those bones a little bit more flexible. This goes back to like a green stick on a tree. Like whenever you break a stick and it's green on the inside and it's just really bendy, that's where this name comes from. So in a green stick fracture, one side of the bone is going to break while the other side is going to bend. And lastly, let's talk again just a little bit more about osteoporosis. So this is going to be the bone thinning disease. It literally means bone holes. This is going to occur in 50% of women over ages 65 and 20% of men over age 70. In this disorder, bone building doesn't keep up with the breakdown of bone. Disease can make bones fragile and the bones can easily fracture. This can lead to issues with vertebral collapse, resulting in kyphosis, which is kind of like this hump that we see old people have sometimes. And estrogen is going to aid in health and normal density of the skeleton. So this is why whenever we see a loss of estrogen after menopause, we see an increased risk of osteoporosis in women. So that is actually all that I have for you on this lecture. As always, if you have any questions or this content is just not sticking for you, reach out to me so I can find a different way to explain it and we can get you where you need to be. Thanks.